Hello, today we're going to discuss with you how to describe X-rays with injuries of upper extremity. So this is an important part of diagnostics, and if we're talking about X-rays, we should have in mind some rules how these X-rays should be done. So actually we need straight views, AP and lateral. We need a good quality of film. We need long film X-ray, and as well, if we're talking about a two bone segment, it's better when both joints are involved on the film. So let's start from first X-ray. Here we can see two views. This is AP view, and this is straight lateral view. First of all, you should determine which location is present on X-ray. Actually, here we can see the distal part of humerus and proximal part of forearm. This is ulnar bone, and this is radius bone. These are humeral condyles. Distal part of humerus is slightly rotated. If it is a straight lateral view, both condyles form one circle. Here we see also distal part of humerus. These are articular surfaces. And you see that there is a loss of contact between articular surfaces of humerus and ulnar and radius bone. Actually, here we can see that radius is located on the lateral side. So we have a lateral dislocation of the forearm. On the lateral view, we can note that both bones are located posteriorly from humeral condyle. That means that this is a posterior dislocation. Actually, if we are classifying forearm dislocation, we know that there are four types. Two types are anterior dislocations, and two types are posterior dislocation. Posterior medial and posterior lateral. Actually, the correct diagnosis for this dislocation would be posterior lateral dislocation of the forearm. Let's move to our next X-ray. So here we have the same joint. We have elbow joint. But if you look at articular surfaces, you will see that these articular surfaces are on their place. So here is humeral condyle, here is olecranum. The head of radius is located on the level of the capitulum. On the straight AP view, we also can see that there is a head of radius, that is a capitulum of humerus, and that is olecranum. So actually, the dislocation that was on previous X-rays was reduced, and that is the X-ray that was performed after the reduction. If you look carefully, you will note that there is a shadow of plaster bandage on this X-ray. It means that, of course, this dislocation was immobilized after reduction, and the period of fixation is 10-12 days. Let's move to next X-ray. So again, we have to determine the view and the location of the injury. As here you can see a part of scapula, glenoid cavity, and a proximal part of humerus. That is a straight AP view. Here we can see also the device that was implanted here, perhaps for some reason. So we see some irregularity of bone, so it means that it was previously a fracture here, but we don't see the fracture gap, and actually the position, the contour of proximal humerus is normal. That means that this fracture was operated and healed well, and quite a big amount of time have passed after this. So we have already the remodeling and the restoration of normal bone tissue. Some calcinosis of this area can show us that there was a fracture previously in this area. As well, we have a metal device. It is lying on the surface of the bone, and it is fixed with some other devices that we name as screws. So that is a plate which is fixed with screws. So this is a fracture of proximal humerus after internal fixation with plates and screws, and the stage of healing is the stage of remodeling. Let's look at this X-ray. Again, we should determine where is the AP view and where is the lateral view. So if you look at the axis of the extremity, so you will see that the wrist joint, which is the wrist and the hand, are located on the volar surface. So this is anterior surface, and this is posterior surface. So we also have a bone fragment, perhaps two of them, which are displaced to the anterior side. We also can see that there is depression of articular surface together with these bone fragments, and actually this part of radius is shorter than normal. That goes proximally and it goes to the anterior side. So here we can see a fracture of distal metaepiphysis of radius with displacement. This is another X-ray, and we also see the wrist joint, that is our AP view, and that is lateral view. Here we can note that we have a nice reduction of articular surface. We can see that axis of extremity is good, and articular surface is restored as well on the lateral view. We also see that there is a metal device which is lying on the surface of the bone on the anterior surface, because that is anterior part. So this is a plate which is fixed with screws. And if we remember, we can use anterior and we can use posterior plates. So this is a volar plate which is used, and it was performed a fixation with locking head screws. So this is specific holes here where polyaxial locking head screws can be inserted. So the diagnosis for this case would be a fracture of distal metaepiphysis of radius after internal fixation with locking head screws and plate. Let's move to next X-ray. Here we can see also upper extremity injury, and that is shoulder joint. We can see that this is an acetabulum. And this is a proximal humerus. And this is a head of the humerus. Here we see a bone fragment. And we understand that there is a fracture of humeral neck. Another thing that we can see that we have some gap, and the head is located not in the cavity. So that is actual fracture dislocation of the proximal humerus. And if we see next view, this is AP view, we also can note that the head is located not in the glenoid cavity. And we also can note the fractures, the fragments that are located here. So on AP view, we can surely see that there is a fracture dislocation of the proximal humerus that should be operated. That is actually another X-ray, but you can note that this is not a film. This is an image from image intensifier, and we can see the position of the humerus after the reduction was done, and K-wires were used to fix the fracture. Actually, this is a normal contour of the head of humerus. It was restored. It is located in the acetabulum, and there were some K-wires that were inserted through the joint, through the acromion, into the humeral shaft to fix this fracture. Okay, that is another interesting X-ray. We will start again from the determining the views. This would be AP view, and that would be a lateral view. There are some rotations, that's not strict views, but what else can we see here? So if you see, this is a radius bone, and this is ulnar bone. Another thing that we can see, we have some gap here. So we have perhaps fracture of ulnar bone in the junction of middle third and proximal third. It is displaced. Another thing that we can note that we have a hairline fracture of the radius bone. Perhaps it was nicely reduced. So also we can see that there are some metal devices as plate and screws that were used for fixation. If you note, the plate on the ulnar bone was broken due to additional injuries that happened. We actually have a fracture of the metal device plate that this consists of two pieces now. If you see on the lateral view, you will note that the axis of extremity is wrong. So we have some angulation that is not suitable for further function and should be corrected. Okay, so now if we talk about the diagnosis, we will say that we have a fracture, we have a repeated fracture of ulnar bone in the junction of proximal and middle third, and healing fracture of the radius bone after internal fixation with plates and screws, and after a repeated injury. And this fracture is with displacement. Have actually angulation. We'll say that that is a varus displacement, as the angle is open to the medial side. And we also have a shift of the distal ulnar bone to the radius side, to the lateral side. Let's move to next X-ray. Here again we can see a wrist joint. We have a wrist joint which was fractured. This is AP view, and perhaps this is an image from image intensifier. So we can know the fracture line, distal radius, and distal ulna. We have a good position of articular surfaces, and actually a good reduction was done. Additionally, we can see that there are some metal devices. These are thin wires. These are K wires. And also we can note that additional fixation was performed with external fixate. So here are some pins that are inserted into the radius bone and into the second metacarpal bone for fracture fixation. Well, the diagnosis would be a fracture of distal metaepiphysis of radius and ulna after internal fracture fixation with K wires and fixation with external fixate, with a good position of bone fragments. Here we can see the lateral view of the same patient. We have a good access of the extremity. We have K wires that were inserted here, and two of them, and we have screws, so-called shunt screws of external fixator, the rod here, and some clamps. This is a Hoffman type of external fixator, and we see the good position of bone fragments. That is another X-ray of a hand, and here we check the anatomy. You'll see that we have first, second, third, fourth, and fifth metacarpal bones. Then we have a row of proximal phalanges, and we don't see a bone pathology here. Proximal phalanges. Then we can note that middle phalanges of the third finger is dislocated. So we can also see this on the AP view. But on the lateral view, we can clearly see that this is a posterior dislocation, as middle phalanx was displaced to the posterior side. So that is a posterior medial dislocation of the middle phalanx of the third finger. Next X-ray, we can see the forearm again. Remember, the best thing if we have both joints involved in X-ray. Here we don't see elbow joint. So perhaps you should make this X-ray not to miss an injury or fracture. But what can we see here? That is our AP view. So on AP view, we can see that there is a fracture, and the fracture line is perpendicular to the axis of the bone. That means that we have a transverse fracture of the radius in the middle third. Another thing we should describe the displacement. and displacement is present here, we have a full displacement of the radius to the ulnar side or to the medial side. As in the anatomical position, that would be lateral side and that would be a medial side. So we have a medial displacement of the radius. If we look on the lateral view, you will see that we have anterior displacement of the radius, as that is anterior side and that is posterior side. We also can check the distal radio-ulnar junction, and we see the gap here. So the ulnar bone is dislocated in distal radio-ulnar syndesmosis. And actually, if we're talking about this injury, that is not a fracture alone. That is a fracture, dislocation of the forearm. This is a Galeazzi injury, when the radius bone is fractured in its distal part or middle part, and the ulnar bone is dislocated in distal radio-ulnar junction. That is an X-ray of a hand again, and we should check carefully about all metacarpal bones and fingers, first, second, third, fourth, fifth, fingers as well, and that is left side, that is right side. So if you note that the first finger has a double bone contour, and that is as an additional finger present here. So we're talking actually about the pathology, which is called polydactyly, and the incidence of this pathology is quite rare. So that is another example of fracture upper limb that was operated already. Again, we should check that this is AP view, that is lateral view, that is a joint, elbow joint. We check articular surfaces. These are okay. We check the lateral view and we see that there is no any dislocation and loss of congruity of the bone. But if we look here, we'll see that there's a shaft which is fixed with a metal device. This is a plate and screws, and we have additional screws that was inserted through the bone. So as we have a stage of remodeling, you don't see clearly a fracture line here, and that's, we know that fracture healed and we can remove the metal device. Perhaps it was oblique fracture, because for this technique usually special leg screws is inserted. So the diagnosis would be oblique fracture of the humerus in the middle third after internal fracture fixation with plates and screws, with a good position as fracture healed and there is no axial deformities present here. That is another X-ray. So we can see an AP view here. We see that there is a head of humerus, that is glenoid cavity, and this is a shaft fracture. It is a shaft fracture, and if we are classifying shaft fractures, remember we should divide our shaft on 3 equal thirds. So that would be a fracture of the upper third. Then we should check the fracture pattern And you will see that this is not a transverse fracture. As for transverse fractures, fracture line goes perpendicular to the axis. This is a fracture line as oblique and with some spiral fracture line. And we also have some comminution, as this is an additional bone fragment, and this is incompleted fracture here as well. So your diagnosis would be a fracture of the proximal third of humerus, which is spiral and comminuted with some displacement. As here we may know that there is some displacement of the distal part, but actually it's not significant. With some shift to the middle side and some small angulation of a few degrees. So this position of fracture fragments can be considered as acceptable. As well, we can see the contour of plaster bandage around the humerus. Means that this patient is treated in a plaster bandage with a non-surgical management. That is another X-ray. We can see this fracture in 3 months. So this is a lateral view already. Here is the head of humerus. Here we can see the fracture line, and we can see that some bone callus is formed here around, involving all these bone fragments. So actually we have a fracture of the proximal third of humerus, which is oblique and comminuted, and we have a good position of bone fragments, and we have a stage of healing. So thank you very much. Thank you for your attention.